Let me ask you something. Did you know that your brain holds 20% of your body's total cholesterol, even though the brain itself is just 2% of your body weight? That's how important cholesterol is. Breast milk, the very first food of life, is loaded with it. Cholesterol is also the raw material for some of the most powerful hormones in the body, things like estrogen, testosterone, and cortisol. It's essential for making vitamin D. It forms the foundation of bile salts, which helps you digest fat. And here's something interesting. Your liver can make up to 60 to 80% of the cholesterol in your body, depending on how much you get from your food. So basically, when you get more cholesterol from food, your liver produces less of it, and vice versa. So let me ask you again, why would your body make something that is harmful? The truth is simple. Cholesterol is not the enemy. In fact, it plays a huge role in healing and repair. So this video is your master guide. It's the only video you need to watch to truly make sense of cholesterol and all those terms you have heard tossed around: LDL, HDL, VLDL, and more. To make it real, I'll even use my own blood report and walk you through the complete cholesterol panel, biomarker by biomarker, so you'll finally understand what those numbers actually mean. By the end of it, you won't need to rely on anyone else to explain your results. You'll interpret them like a pro. So without further ado, let's dive in. The first marker is total cholesterol. This is simply the sum of all cholesterol being carried in your blood, that is LDL, HDL, VLDL, and the rest. Now, I'll be blunt. Looking at total cholesterol alone is an outdated way to judge heart risk. What really matters are the detailed markers and the ratios we'll get into shortly. That said, total cholesterol isn't useless. For example, if it's very low, it can point to problems like hormone deficiencies, poor fat absorption, or nervous system imbalance. But if it's very high, it's not necessarily a reason to panic, but it does mean that you should dig deeper into LDL, HDL, ApoB, and the overall lipid pattern. Okay. For reference, most labs say that the normal range is 125 to 200. Some research even shows that totals up to 250 can be healthy, but only when other markers like HDL and triglycerides are in balance. So the key takeaway here is simple. One number never tells the whole story. So now, before we get into LDL and HDL, it's important to understand one basic piece of biochemistry. Cholesterol doesn't dissolve in water. And since blood is mostly water, cholesterol needs a carrier. That's where lipoproteins come in. Think of them as trucks made up of fat and protein that ferry cholesterol and even triglycerides around your body. So different trucks have different jobs. And once you understand these jobs, cholesterol suddenly starts to make a lot more sense. So with that being said, let's move on to LDL cholesterol. LDL cholesterol is often labeled bad cholesterol, but that's an oversimplification. Its primary job is transport, carrying cholesterol from the liver to the tissues where it is needed for repair, hormone production, and healing. A useful analogy is to think of LDL as a fleet of construction trucks carrying building materials. And the cargo is the cholesterol. It's the material for cell repair, hormones, and healing. So LDL is just the transport system, but without it, your tissues cannot get the materials they need. Now here's a catch. If there is too much cholesterol floating around, or if it gets oxidized by inflammation, smoking, or stress, that's when the problem starts. Oxidized LDL particles are sticky and more likely to get trapped in artery walls. Over time, they deposit cholesterol, forming plaques that narrow vessels, a process called arteriolysis. So LDL itself isn't bad, but excess or damaged LDL is what raises cardiovascular risk. For lab references, less than 100 is generally labeled as optimal. However, in context, levels up to 130 are not automatically concerning provided HDL is strong, triglycerides are controlled, and ApoB count is reasonable. So the real insight comes from looking at LDL alongside the rest of the lipid panel, not in isolation. Let's continue. HDL. HDL is often called the good cholesterol, and for good reason. If LDL is the delivery truck, HDL is the cleanup crew. Its job is to collect extra cholesterol from the tissue and artery walls and bring it back to the liver for recycling or disposal. The higher your HDL, the more efficient this cleanup process is. For men, most labs consider above 40 good, and for women above 50. But if you ask me, the optimal range is higher. 55 to 65 for men and 65 to 75 for women. All right, let's get into more details. Closely related to HDL is something called ApoA1. Think of ApoA1 as the team leader inside the HDL particle, the one directing the cleanup crew. So higher ApoA1 levels generally mean better protection against plaque buildup. Lab references for men is 110 to 180 and for women is 120 to 200. And on the flip side, there is ApoB. So if A1 is the leader of the cleanup crew, ApoB is the marker for the number of delivery trucks on the road. So every ApoB particle represents one cholesterol carrying vehicle. And the more vehicles you have, the higher your risk. That's why ApoB is considered one of the most accurate predictors of cardiovascular risk today. Ideally, you want it below 100, but functionally below 80 is even better. All right, okay. We are not done yet. The remaining biomarkers are also super important, but a pro tip before we move ahead. One number can never tell the complete story. It's important to look at various numbers and only then draw conclusions. A single biomarker may go outside of range due to many reasons, including probably an acute condition that may die down after some time. Another very important tip is to get tested at least once every year, especially if you're over the age of 40. This way, you can see a pattern building up and keep track of all numbers. With that being said, let's look at triglycerides. They are simply fat molecules your body uses for energy. High triglycerides often point to issues like insulin resistance, too much sugar intake, or metabolic stress. They also tend to push LDL particles into the smaller, dense forms that are most strongly linked with heart disease. Ideally, you want your triglyceride under 150 and better yet, below 100. So from triglycerides, we move on to VLDL. VLDL cholesterol, which is basically the carrier that moves triglycerides from your liver to the tissues. Too much VLDL usually means the liver is producing excess fat, often due to poor diet or alcohol or insulin resistance. Another important number is non-HDL cholesterol. This one is simple: total cholesterol minus HDL. That means it captures all the potentially harmful particles, including LDL and VLDL. Many experts actually consider non-HDL cholesterol a better predictor of risk than LDL alone. Ideally, it should be less than 130. All right, now let's talk ratios, because ratios give us some of the clearest insights. And the first one is the HDL to total cholesterol ratio. This tells you what percentage of your total cholesterol is carried by HDL. So when the ratio is above 24%, your risk drops significantly. So for example, if your total cholesterol is 200 and your HDL is 50, that's 25%, which is a healthy sign. In my own case, when I ran my numbers, 55 divided by 157, my ratio came out to be 35%, and that's excellent for heart health. Last but not the least, triglyceride to HDL ratio. Now, this ratio is strongly linked to metabolic health. You want it as close to 1 as possible and definitely below 2. A ratio above 2 often points to insulin resistance and higher risk for heart disease. So for example, if your triglycerides are 100 and your HDL is 50, the ratio is 2, right at the upper limit. The lower this ratio, the better. And there you have it, a complete tour through 10 key biomarkers that gives you a much clearer picture of your cholesterol panel and what it really means for your heart health. But we are just getting started. If you want a truly comprehensive view of how strong or vulnerable your cardiovascular system is, do not miss the next 2 videos. I'll be breaking down blood pressure in detail along with the latest research and updated guidelines, which by the way are a little stricter than most people realize. And I'll also cover 10 more biomarkers that will complete the circle, giving you a full and comprehensive understanding of how truly healthy your heart and blood vessels really are. So hit subscribe, stay tuned, and join me next week. I'm Akash, and thank you so much for your time.